Hi guys, Sandra here, back again. I said I was going to talk a little bit more about my choice and my reasons for going on some medication to manage a rheumatoid arthritis flare and how I go about, in consultation with my rheumatologist, how we go about choosing what is the best path for me. Hi, my name is Sandra, and if we haven't met before, I am someone who likes to say that I am living well with rheumatoid arthritis. It is something that I was diagnosed with at the age of 8. And if you know anything about rheumatoid arthritis and conditions such as this, that it can be very changeable from time to time. I have had the fortunate experience of, since this last year, about this time last year, before I had my knee surgery on my other knee, I've been doing really quite well with my arthritis, but experiencing a flare for several weeks now. And so I went to my rheumatologist and we have had a discussion. We went over the different categories of medication, and she was amazing. She wrote it all out for me for how do we, steroid injections, traditional medications, and biologics. And it was really, really important. She started by explaining I started by explaining my desire to target treatment based on the fact that it was only one joint and to take into consideration the history with breast cancer, lifelong RA, and that it was really important for me to stay away from biologics, injections, and infusions of any kind. I've shared before that part of my decision-making process for me always includes looking at any cardiovascular risk, and I always have big picture thinking of long-term use of these medications and the impacts that it will have on my overall health. I am going to avoid any drug category at this point that would put me into a category of something that is called clinically extremely vulnerable. I don't want that for my body, my immune system, and I also do not want to be identified by any government or health agency as being part of a more vulnerable segment of society. When this all started up in the beginning, I received a letter from the provincial health officer inviting me to come early, come often for the jab. And basically, I was identified as being clinically extremely vulnerable. When that happened, it was back, I guess, March of 2020 or whenever they started. I actually had a conversation with my doctor. She was following up, how do I feel about being identified with as that? And also based on my personal current health at the time, my lifestyle, everything, the medications that I was on at that time, we agreed that I did not fall into that category. And however, I kept receiving those letters because that was somehow on the tick box, even though they say that they didn't have access to pharmacare records. So whatever it was, I received two of the letters inviting me, and it was simply because of the previous medication I was on, which was called rituximab or Rituxan. And it is one of the ones that would make a person clinically extremely vulnerable, not because of my rheumatoid arthritis. But simply because I was on that medication. So when we are going through the list, there were two extra ones on the traditional medication list that when I spoke of that category of not wanting to be in that group clinically or administratively as clinically extremely vulnerable, we took the bottom two off of the list. And I think it's important to recognize and to talk about this. So, our immune system is very complex and it's also very skilled. And having something like active rheumatoid arthritis, that in and of itself, it does mean that my immune system is out of harmony with regards to the fact that my body is basically attacking itself through my joints, and it is something that so basically, according to the Mayo Clinic, rheumatoid arthritis occurs when your immune system mistakenly attacks your own body's tissues. So that is the immune system on that side of things. So it is something to be aware of. However, the medications, such as the Rituxan that I was on, and also it's some other arthritis, and they're also used for other autoimmune conditions. Medications are on there, but also the list includes, to be clinically extremely vulnerable, are recent organ transplant recipients and people that are in actual active cancer treatment and all of these things. So that is like so being clinically extremely vulnerable as a result of taking medications. If there is an option or a choice, why on earth would I want to put something into my body on an ongoing basis that is going to absolutely F up my immune system and make me really vulnerable? No, 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 no. So we didn't do that. She's really understands exactly where I'm coming from. I've always been very, very active, very vocal and active participant in my healthcare. Like I said, when I go to a doctor's appointment, it's always a two-way conversation, which this was as well. So I did get a cortisone injection in my knee to hopefully help settle things down right off the get-go. And we are trying a course of medication that I have been on before, 2 different tablets that are tried and true, more of the traditional and standards, and definitely do not have any of the concerns that I would have with regards to cardiovascular health or being clinically extremely vulnerable. So that's what I'm doing with my medication choices, and hopefully I will be able to get that prescription filled soon, and I will be able to start this regime hopefully for a short period of time. Okay, that's it. Thanks for listening. I hope that this resonates or maybe helps or is familiar to other people that are sort of on this path of having to navigate through our living really well with whatever comes our way. So living well with arthritis is what I am doing today and will be doing tomorrow as well. Thanks for listening. Thanks for watching. Until then, I am wishing you wellness.